Good afternoon, everyone. My name is Captain Jon Townsend. I'm the Naval Air Station Joint Reserve Base Commanding Officer, and we just wanted to get with you today. I'm here with Commander Aaron Frank, who is the Branch Medical Clinic, Lieutenant Seth Larson, who's our Chief Medical Officer here on the base, and we wanted to pass some useful information related to the coronavirus. So first thing I'd like to do is turn it over to Commander Frank.
Great, thanks, sir. Just want to let you know a few things we're doing in the clinic itself. So we're wiping down the clinic chairs, the waiting room, all the flat surfaces with hospital-grade disinfectant to keep the area safe. What we're really asking of you is to minimize when you're sick coming into the clinic. One, we want to reduce exposure. Dr. Larson will go over that in just a little bit. And how do we do that, right? So there's a few things that we have set up that I want to go over a couple times here with you, and the numbers to call. If you're sick and concerned, coming into the clinic is just going to expose you and expose others. So what I want you to do is to call our clinic number. Our direct line is 817-782-5900. Option 2 will get you to the front desk. We'll triage you, we'll ask questions, we'll go over those things, and we'll get you into a virtual appointment or appointment we can do over the phone to try and get you to come in. If we have to see you, we'll have you come in and we'll go over those things, because not everybody's going to be affected by this. There's other things that are still going on as well. We're going to take care of that too. The second one is secure messaging. I want to put out a plug for that. So that's through TRICARE Online. You can get stuff right to your phone. Anywhere that you are, it's going to be able to send information to you. You're going to go back and forth with that information with a nurse, one of our providers in a timely manner. So really, secure messages in the other one. And then the last one is after hours or times when you need to be seen or you want to be triaged by somebody. That's the nurse advice line. You call 1-800-TRICARE, 1-800-TRICARE, 874-2273. That's going to get you right to a nurse directly, and they're going to triage you and let you know where you need to go. That would be the last resort after hours or when we're not open. And then the other one I'll push you towards is Facebook. Facebook TRICARE has a lot of information, pharmacy options, refilling, all those kind of things, updating all your pharmacy coverages. That's really another option that's out there. And so to go over some of the medical aspects, Lieutenant Larson, Dr. Larson is our Senior Medical Officer.
Good afternoon. So I'm going to talk about what the symptoms of COVID are, coronavirus. The symptoms are fever, cough, and shortness of breath. If you develop any of those symptoms, that would be a reason to give us a call. And there are other illnesses that cause these symptoms like the flu, but please give us a call beforehand so we can triage you appropriately, as Commander Frank discussed. And the big thing is protecting ourselves and others as well. So how do we do that? The first thing you want to do is you want to make sure you're washing your hands frequently. Anytime you've been to the bathroom or eating food, anything of that nature, you want to wash your hands for at least 20 seconds with soap and water. Hand sanitizer is good too, but soap and water is effective. Additionally, you're going to want to avoid being around anyone who's been sick. So that means you're going to have to keep yourself at home if you're sick too. So don't come into work if you've been feeling ill. Social distancing is a part of this. So this means anybody within 6 feet has a potential chance of infecting you. So keep yourself at least 6 feet away from others when you have the chance to do so. Avoid touching your face, cover your coughs and sneezes, and clean and disinfect your environment frequently, whether that's at home or at work. And lastly, you've probably seen this around the country where large events are getting canceled. Large events like this are the easiest way to catch the virus and to pass it to others. So trying to avoid those type of events, any gathering over 250 people is recommended. And again, just as Commander Frank suggested, if you have any questions, concerns, or feeling ill, please give us a call at the clinic. I'll turn this back over to Skipper.
Okay, thank you, gentlemen. Okay, so first let me be clear. For Naval Air Station Fort Worth, we have not had any positive cases of corona on board the installation. As some of you may know, we've had some elevated concerns about some folks that have been on international travel potentially exposed. Those folks were transported to civilian medical capabilities and determined not to have been at risk for the virus. So that's where we stand right now. While events are unfolding rapidly, here's what we know for the base and its functions. The base is currently not restricted to any particular population of vetted access personnel. Commissary and exchange services remain in place for all patrons. We are aware that most of the independent school districts in our area have made the decision to continue the spring break posture for our kiddos, and they will remain closed for 2 or more weeks. And that does impose a challenge for a lot of us who work on the installation who are parents. So 2 things there. Number 1, We will be encouraging you to work with your supervisors to come up with your own plan that will work for your child care. At the same time, here on the base for both the Child Development Center and for our school-age care programs run by MWR, they will continue. We are talking about a plan to maintain a capacity level for school-aged care similar to what we had with the spring break. So we'll maintain flex employees that will be able to spend the time with your kiddos, and that will be worked directly with the school-age care program folks that y'all are familiar with. At this point, most of the decisions related to the virus and our operational functions on the base are at the discretion of unit level commanders and will remain there. My job is to protect the mission of the base as a whole, and our ability to perform the mission. That primarily means our people and protecting our people. So that will be the focus. As stated, we don't have any current restrictions for access to the base. When and if that should be warranted, we will convey that information. And if we go down the road of essential personnel only, then we'll communicate that reality should that be necessary. But for now, please heed the advice of our professionals as we're all watching this unfold. Hopefully we're out in front of this, and we'll continue to communicate as we go down this road. Thank you, and have an enjoyable weekend.